I dare any of you talk about it in that way. That was incredibly courageous, Delanise. Let's give her a round of applause. Thank you. That 8 was there, and we have a responsibility collectively to make sure that all of the people know that this service exists, that if you are experiencing a mental health crisis or a loved one is, 9. This morning, I'm joined by Kelly Crosbie, the Department of Health Director of the Division of Mental Health, Developmental Disabilities, and Substance Use Services, Secretary of Public Safety, Jeff Smythe, Secretary of Adult Correction, Leslie Dismukes, Director of State Human Resources, Stacy Meyer, and many law enforcement, healthcare, and mental health professionals. I will be signing an executive order to strengthen our North Carolinians. Recently, there have been several tragic instances in serious mental health crisis had a terrible, horrific consequence, whether it was in Charlotte, train, or a restaurant, or here in Raleigh and someone's own home. Our hearts break for the families and friends who lost a loved one. Of course, the vast majority of people with mental health challenges don't pose any risk. They don't pose risk to others. They may not even pose risks to themselves, although sometimes they do. However, a small minority of people who are experiencing paranoid delusions can pose a risk to public safety when their serious mental illness goes untreated. Everyone deserves access to care, and these moments have shown us that our system needs to work better. Better for the people who are suffering, better for those who are around them, and better for the entire community. I've spent the past several months meeting with law enforcement officers and mental health care providers across the state. I visited behavioral health urgent care centers, facility-based crisis centers like the one that Natasha Holly, where's Natasha? Hiding back there behind me. She runs one in Pitt County, and these facilities are truly impressive and important institutions. My team and I have asked law enforcement, they've asked mental health providers, we've asked state and local public officials, where are the gaps? What are they? What are we doing right? What do we need to do more of? And the answers to those questions have led us to today's executive order. I'm directing the Department of Health and Human Services, Department of Public Safety, the Department of Adult Correction, and the Office of State Human Resources to take unified action to strengthen our behavioral health and criminal justice systems for both young people and adults alike. We will support people in crisis at different stages, and this is not for all of mental health. The mental health solution is very, very broad. We're focused on the nexus, the connection where mental health can link to public safety. First, when a person experiences a behavioral health crisis before any crimes have been committed. First, interacting with law enforcement or mental health care providers. Second, during incarceration for those people who have committed crimes. And then third, when they reenter communities following incarceration. These actions will help people, support officers and healthcare workers, and keep us all safer. Let's start at the beginning. When someone is in a crisis and they or someone else calls 911, law enforcement often responds to these calls for service, whether a crime has been committed or not, because we all know that law enforcement is there for us 24/7. But that can take an officer off the street fighting crime, and there may be other people who are more professionally trained to deal with the person's crisis. That is why we must expand the co-responder model here in North Carolina. That's when you join law enforcement in coordination with social workers and mental health professionals to respond to service calls. Whether it's embedding a social worker at the 911 dispatch to identify which person should be responding to which call, or strengthening the relationship between 911 calls and 988 calls. 988 calls go to the National Suicide Behavioral Health Crisis Line, and it's intended to divert traffic from 911 calls, which should be focused on criminal justice calls. We need to make sure that the public knows about 988 and that its operators coordinate with 911 operators to route the right type of assistance to the right person, the right call. And that's why Delanice being here and lifting up 988 is so important. We also need to know that the public knows about these calls. We have to improve our involuntary commitment process in the state. Involuntary commitment is a needed resource for folks who are struggling with mental health issues or substance use who might hurt themselves or others. Involuntary commitment, or IVC as it is known, those petitions are increasing, but we don't have enough beds to treat all of the people who need them. So I'm directing the Department of Health and Human Services to consult broadly and to recommend IVC reforms for the state. I applaud the efforts by the House IVC Committee and the North Carolina Collaboratory for also tackling this critical issue, and we must work together in a coordinated fashion as part of this executive order to identify and lift up the best solutions to this most challenging of issues. Next, we have to ensure that if people need treatment while they're in prison, they get it. 3/4 of people entering Department of Adult Correction custody have substance use issues. 40% have mental health issues. Those numbers are even higher for juveniles. 98% of juveniles committed in our state have at least one mental health diagnosis. 98%. 90% of people who are in prison will leave eventually. 90% of the people who are incarcerated will get out. These problems do not solve themselves just by time passing. They need to have interventions to address the underlying issues. And we kick these problems down the road at our own peril. Getting folks on a path to recovery and stability while they are in custody will help them to lead productive and positive lives when they get out, instead of getting caught up in crime again. It keeps us all safer. I'm directing DHHS and DAC to collaborate on standardizing and improving the state's existing treatment management program in the Department of Corrections. I'm asking DPS, the juveniles are with DPS and the adults are with adult correction. I'm asking DPS and DHHS to provide recommendations on creating juvenile-specific mental health crisis unit that will help get these young folks the appropriate care they need when they are in our youth development centers. Finally, additionally, we need to strengthen our supports when people are reentering the community after incarceration. 18,000 people will leave a state prison this year and come back into the community. This is referred to as reentry, and reentry can be a very challenging time of transition. If people do not have the support that they need in place when they get out, it's all the more likely they will repeat the behaviors that led them to getting incarcerated in the first place. I'm directing DAC and DHHS to recommend strategies on improving and expanding supports for people with mental health conditions who are leaving custody, whether it's getting them connected to healthcare services, housing, or job opportunities. These strategies will further the state's ongoing Reentry 2030 goals. As we're looking to strengthen all parts of our behavioral health and criminal justice systems, we must support our frontline workers, the public safety and behavioral health workforce, who are doing the hard and important work of serving people in need. Our law enforcement and correctional officers who keep our communities safer, and our behavioral health workers who provide people with critical treatment, they are the backbone of public safety and public health in this state. Yet we have too many vacancies in these essential professions, and when we don't meet our staffing needs, it just adds to the burnout of those who are doing this hard and important work. The vacancies we have in these positions, they're not just numbers. They have a real impact on our lives. At the Department of Adult Correction, we have a vacancy rate of nearly 50% for correction officers. 1 out of every 2 positions is unfilled. it shouldn't be a surprise, frankly. Starting correctional officer pay in North Carolina is 49th in the country. At DHHS, even though there is a long wait list of people needing inpatient treatment in North Carolina, a quarter of our inpatient units that could serve as many as 300 people sit empty simply because we don't have the staff to serve them. We spent all this money on this facility. The units are there and they are empty, even though there is a long line of people in waiting to get that kind of care. Why? Because we're not paying the nursing assistants enough money to have enough of them to serve those people. It's a travesty. I'm also directing OSHR to help DAC, DHHS, and DPS to identify and expand promising recruitment efforts, implement retention programs, address staffing shortages, and make policy recommendations. Whether it's paying law enforcement, juvenile justice staff, correctional officers, or nursing assistants more, or increasing the state's capacity to handle involuntary commitment petitions, I am counting on the General Assembly to partner with us in this work. I'm grateful to see so many legislators here today. My team and I have been talking with legislators about this executive order as we have put it together, and there is a lot of common ground on these issues. As we embark on these efforts, I want to underscore that we're not starting from scratch. There is important and positive work already underway in this state. I have been inspired by what I have been seeing as I travel the state. And I want to recognize all of the people and organizations who are already enhancing behavioral health care and public safety in our state. Their voices were instrumental in shaping this executive order, and you will be essential to our collective success. I also want to underscore that there are many policy interventions outside of mental health care, outside of the criminal justice system, that matter. Folks need a way to pay for their health care and their kids' health care. That's why I'm continuing to urge the General Assembly to fully fund Medicaid, the primary payer of behavioral health services in this state. Folks need nutrition to be healthy. That's why we work so hard to save the Sunbucks program for this summer to fight against food insecurity for children during the summertime, which is the hungriest time of the year because they're not in school getting those school meals. I urge the General Assembly to leverage these federal funds next year and going forward. It's why we are laser focused on protecting North Carolina's SNAP program in the face of dramatic federal cuts. Folks need stable housing. That's why we are working to build more special needs housing and more housing of all types by lowering rents. And people need good jobs. That's why I'm so committed to excellent public schools and real job opportunities in every corner of North Carolina. People need to have the skills and knowledge to succeed in an ever-changing economy and get good jobs with good wages. This executive order is not intended to remedy all of our challenges, but we have a real problem staring us on the face, and the people of North Carolina deserve us to make progress. Everyone wants to live in a safe place. Families are looking for answers when their loved ones are in crisis. People who make a mistake in the past are trying to get their lives back on track. For all of us, we have a solemn responsibility to enhance access to health care and to strengthen our criminal justice system. That's how we will build a safer and stronger North Carolina. I want to thank you all for being here this morning, and I will now bring forward Kelly Crosbie from the Department of Health and Human Services. Kelly.
Thank you, Governor Stein, for that kind introduction. And thank you for your commitment to improve mental health care across North Carolina for all North Carolinians. I want to say a special thank you to Delanice for being with us today and for her mom, Badia, who's in the audience. Thank you guys for being here. My name is Kelly Crosbie, and as the governor said, I'm the director of our Division of Mental Health, Developmental Disabilities, and Substance Use Services for our Department of Health and Human Services. This executive order marks a milestone for North Carolina. It recognizes the important role of mental health in the health and safety of our communities here in North Carolina. It's critical that we're reaching people who are in the justice system or at risk of being involved in the justice system. People who are in crisis deserve and need care. The governor already gave you some statistics. People who are in prison, 40% of people in prison self-identify as having mental health issues. 75% of people in prison identify as having substance use issues. I'm proud to say for the past 2 years, DHHS, with our partner cabinet agencies, with our partners in the community, you all are here today, we've been working hard on the very issues addressed in this executive order. But the executive order gives us new strength, it gives us new directives to continue the good work together. We have focused on improving crisis supports, improving services to adults and children in the justice system, and also strengthening our workforce. We need more workforce. Let me tell you about some of our standout accomplishments, and many of our partners are here today who are part of those accomplishments. We talked about 988. We've continued to expand 988. We reach over 12,000 North Carolinians every day, and 988 is able to de-escalate crises, link people to care, send out mobile crisis teams into the community to consult with 911, to consult with law enforcement. It helps people in that moment of crisis. The governor mentioned crisis centers. We've opened 6 new behavioral health urgent cares, 1 new facility-based crisis, that's a community crisis center, and 2 new peer respite centers. These are all places in the community that divert people from being arrested. They divert people from going into the emergency room. They provide safe, therapeutic care for people in desperate need of mental health treatment. We've supported 4 new co-response teams, and we've expanded a program called MOORS. It is a crisis team specifically for adolescents and their families. It is community-based and go into the home, it can go into schools. We expanded that in 16 counties across the state. We've also expanded additional programs that support people in the justice system or at risk of being in the justice system. We've expanded in 6 counties our law enforcement assisted diversion program. That diverts people who are arrested into treatment as soon as possible. We have 10 new FACT teams. FACT teams are forensic community treatment teams that provide intensive wraparound services to individuals leaving carceral settings in the community. We have provided additional supports to youth in the juvenile justice system. A program called TalkSpace, it's available to youth statewide on demand so they can get counseling whenever they need it for the mental health issues. As the governor said, 98% of those children who are involved in the juvenile justice system have mental health concerns, and they need treatment as soon as possible. We've also expanded right here in Wake County a capacity restoration program, which is a jail-based mental health program. That program joins the Mecklenburg jail-based program and the Pitt County jail-based program. So people with serious mental health issues who are incarcerated can get mental health treatment while they are incarcerated. We've also been working on increasing our mental health workforce. We announced a very broad loan forgiveness programs for mental health providers who are willing to provide service in our system. And we announced a joint public leadership program with 25 schools of social work that rewards people, it trains people to come into the public system, but also rewards them for years of service in the system. So we're making great strides, but we know there's a lot more that we've got to do. The governor's executive order will lead us all forward together, and it will create real change for communities across the state. I'm grateful for our community. I'm grateful for my state sister agencies. I'm grateful for all the folks behind me that are working together to create a healthier and safer North Carolina. Now I'm going to introduce my new friend and my colleague, Secretary Jeff Smythe from the Department of Public Safety.
Good morning. Thank you, Governor Stein, and thank you to everyone who's here today. It's a testament to your commitment that you braved the cold to get here, so thank you so much. I want to start by saying how strongly I support this executive order, why it matters so much to the work we do every day in the Department of Public Safety. I spent 35 years as a police officer in 2 states. Regardless of the shape of the badge or the color of the uniform, public safety professionals have been placed on the front line dealing with mental health issues for decades. We know that 40% or more of our calls relate to individuals experiencing mental health issues. Not all are in crisis, and yet they intersect with law enforcement far more often than folks realize. Often not because they're a criminal, but because they are struggling with untreated mental illness, addiction, or trauma. And too often, the only tools available to the officers or the deputies in these moments are handcuffs and a jail cell. It's not fair to the individual in crisis, it's not fair to their families, and it's not fair to our law enforcement officers, correctional officers, or those who live and work in our communities. It takes a real toll on the mental health of the men and women who respond to these crises every day. Public safety and behavioral health are deeply connected. When our behavioral health system is strong, coordinated, and accessible, everyone is safer. When it isn't, law enforcement and correctional systems are left to fill gaps they were never designed to handle. At NCDPS, we're already working in this direction through reentry programs, partnerships with behavioral health partners, crisis intervention training, and other initiatives that emphasize coordination and the continuity of care. This executive order gives us stronger alignment, clear direction, and a shared framework to better coordinate the work already underway across state government. Governor Stein has spent the last several months listening to law enforcement, to mental health professionals, to families, and to people with lived experience. What they've told him is clear. We need better coordination, better access to care, and better outcomes. This executive order moves us closer to that goal. Governor, thank you so much for your leadership and for recognizing that investing in people's health is one of the most effective ways we can invest in public safety. The Department of Public Safety is proud to stand with you as you sign this order and put these commitments into action. Thank you. Governor.
I'll now sign the executive order joined by Tim Crawley, who is Chief of Staff to Secretary of State Marshall. Thank you all. Trying to get the cover sheet of these pages. Trust me, it's time. Thank you all for being here very much.